I'm Dr. Stuart Winthrop, and I'm going to talk to you about modern advances in cataract surgery. There have been some tremendous advances over the past year that have made cataract surgery now the most successful major surgery performed in the United States. The major advance in cataract surgery has been the introduction of the femtosecond laser. The advantage of the LenSx, or the femtosecond laser, is it's a computer-controlled laser that does the same thing perfectly every time. As good as I am, I'm human, and these machines are computer-controlled and again can perform these different functions every time in exactly the same manner. Another technological breakthrough has been with the use of the measuring devices that we have to determine the power of the intraocular lens. I have what's called the LenSx, which is a new piece of equipment that's basically an ultrasound, but the advantages of the new technology, the LenSx, is it more accurately can measure your cornea, and those calculations are then transferred to a number of different instruments that we use intraoperatively that can actually further improve the outcome. The Aura technology we have is now an instrument that we can use at the time of surgery. It's basically an infrared aberrometer that's hooked onto the microscope at the time of surgery. Once the cataract has been removed, we can turn on Aura and take another measurement of your eye that is more accurate than what we're able to do in the office. Another piece of the puzzle that has been added is a piece of equipment called Varion. And what this does is that when we measure you in the office or any time that you're standing, we get one measurement, but when you lay down, what you do, whether it's under the LenSx laser, when we're doing the surgery, your eye actually cyclotorts or rotates, and everyone's a little bit different. So Varion is a really cool technology where we actually take your picture and it identifies different conjunctival vessels. And then when you come to surgery, we retake the picture, and then the machine can auto-regulate your cyclotorsion and line it up so that we know the exact axis for putting in your toric implant. The surgery itself is still 10 to 12 minutes. It's painless, there's no shots, no needles. When I'm done, actually, there's not even a bandage on the eye. And you're back to full activities. You can bend, lift, exercise the following day. So the downtime of surgery is just the day of surgery. Now, the reason that I'm so for these upgrades in technology is the outcomes and results that I've been obtaining with them. In the past, LASIK has really been kind of the standard, if you will, of what predictability and outcomes. And with these upgrades with the modern day cataract surgery, the outcomes we're getting are almost equal to LASIK. So it's really amazing to me that when we see the post-op cataract patients now, it's almost like seeing LASIK patients in terms of what their visual outcomes are. So the results are not only gratifying for the patients, they're extremely gratifying for me, and really have made it really continue to be fun in terms of practicing ophthalmology and being able to deliver the level of care that we can here in Santa Barbara. As a matter of fact, the technology that I've been talking about, I feel very fortunate that I'm one of the very few ophthalmologists really in the whole country that has the availability and access to all this technology. My hope would be that as time goes forward, this does become the standard of care for cataract surgery. Its obvious advantages with its speed, its reproducibility, its fabulous outcomes make it really a joy for not only the patient but for me as well.